Coronary obstructions are basically defined when the blood flow to the myocardium is compromised due to the obstruction of the coronary vessels, or the coronary vasculature on a whole is compromised. So we'll be discussing the underlying causes due to this compromisation of the coronary vasculature, what basically is the underlying pathology due to it, what are the different disease mechanisms that are involved in such an obstruction. Now, what are the different findings that we are going to observe in a death that is caused due to the coronary obstruction? That is also going to be discussed over here in this section. Mainly, we'll be discussing the coronary atherosclerosis and its stages, complications in the coronary atherosclerotic lesions. There are a lot of complications basically that can ensue as an episode after the atheromatous plaque has been formed. So what are the different kind of routes that it can take? Again, we'll be discussing the coronary thrombosis, that is basically the complete occlusion of the coronary arteries by the thrombus, and the stenosis. If it is halfly occluded, then it's basically a stenosed artery. So we'll be discussing the occlusions along with the stenotic lesions that will be discussed over here in this section. So mainly, the ischemic heart disease is basically caused due to the coronary atherosclerosis. Then the hypertensive heart diseases, it's the secondary cause and the main cause, most of the popular or the leading causes of the ischemic heart diseases. Then we have the aortic valve diseases, and moreover, it can be a genetic aortic valve disease or it can be an acquired condition. Both of them are basically part and parcel over here. Anomalies of coronary circulation, they're again considered. There can be a different modalities in different individuals they're observed. It can be a by birth defect or an acquired condition or acquired malformation. Then we can have other coronary artery diseases. For example, polyarteritis is basically an infectious state of the coronary vasculature that can lead to a compromised vasculature. It's again going to basically form defunctioning of the cardiac muscle, and that is how it is going to complicate the situation. Cardiomyopathic enlargements, they're again considered as one of the complications and one of the underlying causes for the ischemic heart diseases. And we can have some congenital heart diseases. It can basically variate from the aortic valve diseases to some other malformations of the cardiac muscles that can contribute towards such a ischemic heart disease condition. So basically in this diagram, you can see there can be the fatty deposits in the coronary vasculature, and that is going to basically compromise the blood flow to the cardiac muscle. So the staging is again very important. How do you stage this condition of atherosclerosis? First of all, it's basically the pathological intimal thickening. So that is the underlying pathology over here. There's an intimal thickening observed. Moreover, there is a loose lipid-rich fibrous tissue, and there is no lipid core. If you observe the vasculature even under the microscope or even on the gross examination, there'll be no lipid core over here. Then we can have a fibrous cap atheromas. It's basically the second stage or a more advanced stage of the disease, in which we have a definitive lipid core, and there'll be a thick multi-layered cap of the fibrous tissues. We'll have a limited or patchy calcification along with it, and the lymphocytic infiltrates are observed at this level. Moving on, we have the third stage, or an even more advanced stage over here, that is basically the thin fibrous cap atheromatous stage, that in which we have the lipid core. Along with it, we have a thin inflamed fibrous cap along with it. So there are a lot of complications that can occur after this staging phenomena and after the atheromatous plaque has been formed. The plaque, first of all, can rupture. It is one of the complications that can occur at this level. The rupture of the fibrous cap can take place. It can be an isolated associated thrombus formation as well. So if there is a plaque rupture, any of these two conditions can occur. Either it can be rupture of the fibrous cap, or it can be the associated thrombus formation. If we have a plaque erosion, the plaque is eroded on its outside or on its external surface, then the ulceration of the endothelial lining basically takes place. It can be a thrombus formation, and in early lesions, pathological intimal thickening occurs. Then we can have a fibrocalcific lesion if it is a long-term plaque or a thrombus that has been formed for a very long period of time. it can get calcified. The fibrosis or the large areas of calcification can be formed at this level. It can be a dystrophic calcification of the lipid cores. And we can have a completely calcified nodule. This is another complication that can occur. It can be a heavily calcified lesion, and the end stage of the atherosclerotic process can occur. The stenosis or the occlusion of the major coronary artery or its branches can take place. It can be an atheromatous lesion, and subsequent myocardial necrosis occurs after these atheromatous lesions have been formed, because of course there will be a compromised blood supply. So we'll have a subsequent myocardial necrosis followed by coronary atheromas and myocardial fibrosis and infarcts. There'll be a lax, collapsed, and the unstretched walls of the vasculature will be found. So all of these findings are going to indicate that there was some sort of a compromised blood flow to the cardiac tissue. We can have coronary atheromas, and these atheromas are basically focal with irregular plaques. Various stenosing effects are found, and more diffuse lesions are found in this area. Examination of the major vessels is very crucial at this point. For example, the aorta and the circumflex arteries and the descending and the ascending branches, all of them will be examined at this level. We'll frequently have the cross-cut sections and examine the atrium and the ventricles at this level as well. The plaques are eccentric and leaving the crescentic residual lumen as well. Pinhole central lumen is basically indicating that the lumen is stenosed. Lesions, ulcerations, and calcifications are also looked for, so that is going to be a direct evidence towards the fact that the vasculature was compromised, basically. So there are a lot of complications that can occur. We can have ulcerated plaques at this level, and endothelial thickening involves the media as well. As in this diagram, you can see it's basically the comparison of a normal artery with the narrowing of the artery, which is caused due to the plaque, and the arterial blood flow is thus compromised due to the thinning of the lumen. So it's one of the complications that can occur, and after the endothelial thickening involves the media, lipid infiltrates are found in the vessel, and there is a luminal reduction as well that is going to compromise the blood flow to the cardiac muscles, and the erosion of the central necrosing process is another factor that we have to look for. Then we'll have basically the rupture of the plaque in the lumen, and that is again when the infiltrates are basically laid down in the lumen, that is again going to compromise the blood flow to the tissue. At autopsy, you're going to find, basically you're going to take two cuts that are joined longitudinally. The heart is dissected in figure D, as it is already mentioned. We'll have a fluorescent or immunohistochemical techniques are applied at this level just to indicate what tissue has been damaged according to the blood supply, which blood supply was compromised, and which tissue or which portion of the heart was damaged. Small fibrotic areas in the myocardia, they are seen, and there's a long-standing coronary disease at this level. Then basically we'll find hemorrhages. It's one of the complications of the atheromatous plaques, and it is found in the subintimal hemorrhages. And reduction in the blood carrying capacity is one of the complications, and the rupture of the small blood vessels is followed after this. There is an erosion of the extension of the degenerative process at this level due to the exertion or the emotion. Raising of the cap or of the plaque, it's again one of the complications that can occur. It's one of the situations that can occur after such an incident. Acute coronary occlusion can take place. Coronary thrombosis is followed after this, and reducing lumen of the coronary artery, it's one of the complications as well, followed by the precipitating thrombosis. Now, the coronary thrombosis, we find that there is an atheromatous plaque initially, which is followed by the progressive internal necrosis due to the compromised blood supply, which is followed by the erosion of the luminal surface, and after that there is an exposure of the fibrofatty contents of the plaque, and that is basically when the plaque expansion takes place, and that is going to further compromise the blood flow. Reduced blood flow to the distal myocardium is observed even in the radiographs or even in the immunohistochemical techniques. Aneurysmal coronary arteries are looked for. Myocardial necrosis and resulting status also has to be looked for at this level, and there should be tests basically to carry out for the coagulability of the blood. It's again very crucial, and thrombotic lesions, whichsoever parts were compromised at that level and that were damaged, mostly the left ventricle is damaged because it has got the fair thickness to get damaged at this level. So the sites of the coronary stenosis and the occlusions, they have to be looked for. We can basically apply these dye techniques for this phenomena. There are the major trunks and they are mostly affected at this level. The sites of predilection in 3 major arteries and first 2 centimeters of the anterior descending branches of the left coronary artery. Mostly it is the right coronary artery which is more distal to the thrombosis. And thirdly, we have the proximal part of the left circumflex artery at this level. So at autopsy, basically you're going to look for and transect the proximal parts of the coronary arteries to look for any signs of the coronary thrombosis. So in this section, basically we dealt with the coronary thrombosis. How does it take place? What are the complications that can occur after this phenomena? They're discussed over here. So that is the end of this section. Thank you for watching scardio.com.